I'm Jared Stremel, and I'm going to be presenting my uh, Master of Health Administration practicum, which I completed at Neurology Consultants of Kansas. I completed this project under the guidance of Crystal Page, the practice administrator, in the spring of 2025. My project was to create an outpatient scheduling training and reference guide and suggest efficiency improvements for this department. Neurology Consultants of Kansas was opened by the original 4 neurologists at the practice still today in 2005. There are now 7 neurologists, 1 neuro-ophthalmologist, and 5 nurse practitioners in our practice. They complete general neurology exams and follow-up exams, as well as specialty testing, including electromyography and nerve conduction testing, electroencephalogram testing, magnetic resonance imaging, Botox for migraines, occipital nerve blocks, ophthalmological treatments, neuromuscular ultrasounds, baclofen pump maintenance and refills, treatment of sleep disorders, vagal stimulator maintenance, and carotid Doppler studies, and several more specialized treatments. My background with neurology consultants, I started there as Crystal's assistant in July of 2023. From there, I trained in all of the front office positions so that I would be able to fill in as additional help if the workloads were heavy or if there were absences, vacations, etc. After being fully trained in all of those front office departments, I was promoted to the front office manager in October of 2024, coinciding with additional completion of this program. I am responsible for the training of all new employees in the front office positions, and in my training and management as the front office manager now, I have experienced some difficulties with the outpatient scheduling department, resources and training documents, inefficiencies in the department, and a variety of other things. So as Crystal and I were discussing my practicum project, I mentioned that there are outdated training materials, handwritten notes, inconsistencies in how the same tasks are done between different staff members. Workflows are inefficient, and there's some technological roadblocks that they faced, as well as not necessarily adhering to all of the legal and regulatory standards such as HIPAA and the No Surprises Act. So Crystal and I decided that it would be a good idea to do a training guide, a reference manual, and then for me to observe the workflows of the members of that department to suggest some efficiency improvements and find existing technological tools that the department can use to advance their workflows and improve their efficiencies. So my objectives for this practicum project were to observe and train with the current outpatient scheduling staff to learn their workflows and identify inefficiencies and inconsistencies amongst the team members, to sort through, organize, and condense all of the regularly used referential materials, materials that they use on a daily basis, remove outdated information, updated the needed information, and consolidate and reorganize the information in a logical and easy to use format. to use my experience as the front office manager to compile a comprehensive training manual that incorporates my observations and training, as well as the materials consistently used in conjunction with the roles and interactions required for working with the other departments in the office and the office as a whole. And then to finally compile the training manual and resource reference guide into an electronic document that can be easily updated and print physical copies for use in a 3-ring binder for easy daily reference for the members of this department. The outcomes of my project were that the training manual and reference guide have been completed and published to our shared drive on the secure office server. The binders were compiled with these sets of documents and were distributed to the outpatient scheduling staff. Features in our electronic health records software have been activated to improve efficiency and ease task burdens. And new protocols and policies were written and have been implemented to improve and maintain efficient workflows. Part of the reason for the master's program practicum project is to focus on the 5 domains of the Master of Health Administration program. The first of which is communication and relationship management. In this practicum, I was able to improve communication with the outpatient scheduling department amongst themselves, and improve the communication between outpatient scheduling and the other departments in the office, as well as between that department and management. And that was really one of the key tenets of this project. The practicum helped me to learn how to effectively and professionally communicate these problem solutions and new policies, all while listening to my staff, mediating conflicts, and facilitating open communication channels between the departments in the office and between the staff and management in that department, between outpatient scheduling and management. So between outpatient scheduling and Crystal and I. The second domain of the MHA program is leadership. Learning the intricacies of the outpatient scheduling and developing a training manual for new employees in the future enhanced my leadership skills. Training these new employees is a crucial skill for a leader, and showing that you know the responsibilities of the job, how to do the job correctly, where to find the resources that are needed. All of these are signs of being a reliable leader and a reliable source of knowledge that new employees can come to when they are in need of help or are lost on some task that they don't do regularly. Being able to demonstrate those skills has been beneficial to us because we did hire a new employee during this process, during my practicum project. And although the project was not completed when that happened, the work that I had done already had proved to be very beneficial to our new employee and to myself in being able to educate them on how to do their job correctly and to communicate with their other department members to look for assistance when they need it as well. The practicum helped me to develop my teaching skills and provided a thorough explanation of processes and policies to ensure consistency and adherence to applicable laws and regulations. The third domain is professionalism. Professionalism is an area that I did need to grow in substantially from previous jobs. I will admit that I have been lacking in professionalism, but starting at Neurology Consultants back in 2023, I had a different mindset because I had already been in this program for a year, and what I had learned, I was already able to implement right from the get-go in this office. Uh, but the practicum itself allowed me the opportunity to grow and practice my professionalism even more through disciplinary steps. Unfortunately, we terminated an employee uh, during my practicum period, and the hiring process of a new member in this department. Excuse me. Additionally, navigating the pushback from some of the implemented changes um, required a level of professionalism that I attribute to this program and to Crystal's guidance through this practicum. Uh, Convincing the members of the outpatient scheduling team to adapt to the new workflows was a practical way to apply my education regarding professionalism as well. Domain number 4 is knowledge of the healthcare environment. By collaborating with the outpatient scheduling department to develop new procedures and policies, we are ensuring that applicable laws such as HIPAA and the No Surprises Act were accurately followed. Additionally, I have updated some security features during my practicum project to enhance workflows with our electronic health record system and through secured emails. I have trained staff on the updated methods for insurance prior authorizations and referrals, um, mostly online processes that have already significantly reduced long wait times on the phone, and have made these processes much quicker and sometimes instantaneous. We can get a prior authorization or a referral just like that, which is extremely helpful for progressing our patients' ongoing care and ensuring that they have high quality and highly effective healthcare. Finally, domain number 5 is business skills and knowledge. Improving the efficiency and accuracy of the outpatient scheduling department at NCKS enables our office to expedite patient care, reduce errors that can lead to delays in insurance reimbursements, comply with regulatory laws that impact Medicare reimbursement rates, help our practice meet its MIPS goals for Medicare, and foster positive relationships with our patients. These business skills are crucial elements of my education that I was able to implement during this practicum project through a variety of the ways that I've already discussed, but it's the the insurance and billing portion of how an office runs is not something that I was really familiar with prior to starting at Neurology Consultants, but uh, I've I've learned so much through hands-on experience in the office, and learning how those billing practices affect the different departments within the office as well. Um, and of course, learning how many of those systems work through this program. So it's been very beneficial as a back and forth, being able to apply what I'm learning in school at work and then use my hands-on experience from work back in school. It was kind of the perfect setup. Finally, I'd like to just share with you some of my practicum takeaways. Um, I am not sure where my healthcare leadership journey is going after neurology consultants. If there is an after neurology consultants, I'm not sure, but I do feel confident that I've acquired the foundations of all of the skills that I will need, whatever that may be, and that as I continue to gain experience in administration roles, being at Neurology Consultants, or if another opportunity should arise, that I will be able to continue to grow uh, in those foundations that I've established through this program and through this practicum. I've developed interpersonal and relational skills that enable me to lead staff to success, to teach and train them effectively, to manage conflicts, to listen and implement changes from the team, and to support my staff in delivering excellent healthcare to our patients. Um, Learning the legal and regulatory guidelines as well as the billing and insurance laws has been challenging but rewarding because all of the departments are interconnected, and the ability to explain how one part of a job affects the jobs of others in the office has helped to build a mutual understanding of the importance of some of the policies and procedures to maintain compliance with them. Um, it has been altogether a morale booster for the office to have more mutual understanding of each other's roles. I'm happy to be staying at Neurology Consultants for the foreseeable future. I am confident that my experience working there, my practicum experience, and my education will propel me forward if the right opportunity should arise for me to move on to another position. Um, and then finally, I just wanted to give a thank you to Neurology Consultants. It's been a fantastic fit for my MHA practicum, and as a starting point in my career in healthcare administration. Um, I I don't believe that I would have been able to successfully balance work and school and practicum if I wasn't able to uh, complete my practicum at the same place that I work. That was extremely beneficial to me in being able to uh, maintain uh, my family life and my work and education in a good balance. I also want to thank Crystal Page, all of our physicians, uh, Dr. Reddy, Dr. Schwartfeger, uh, Dr. Janello, Dr. Murphy, Dr. Bohm, Dr. Grillinger, Dr. Roselle, and Dr. Mayans, as well as all of our nurse practitioners, Amber Wagnon, Kim Hornbaker, Jessica Kapoor, uh, Erin Chu, and Bridget Howard, um, and all of our staff at the office. Uh, there's 30 additional people to our providers that really make our office run, and they have been an excellent source of grace and support for me as I have learned and applied my education in real time, working alongside them. So, and that is my presentation. Thank you for listening.